Welcome back to Oncoverse, the channel dedicated to making the science of cancer therapy accessible, one drug class at a time. Whether you're a pharmacy student, a nursing student, or just curious about how medicine fights cancer, you're in the right place. Each episode adds another piece to your oncology puzzle, helping you understand complex topics in a clear and engaging way. Today, we're diving into a fascinating drug class that targets one of the cell's most essential enzymes, the topoisomerase inhibitors. Get ready for a journey through the mechanisms, uses, and future of these powerful anti-cancer agents. Topoisomerase inhibitors are among the most widely used anti-cancer agents globally, playing a key role in treatments for lung, ovarian, colorectal cancers, and leukemia. In this episode, we'll explore how these drugs work, introduce you to the key agents you need to know, review their major side effects, and discuss how this drug class has evolved into one of the most exciting areas of cancer research today, especially with the rise of antibody-drug conjugates. Let's get started and see why topoisomerase inhibitors are so important in modern oncology. Understand how these drugs work, we first need to look at the enzyme they target. Inside our cells, DNA is tightly coiled, and every time a cell needs to replicate or transcribe its DNA, that coil must unwind. This unwinding creates tension, similar to twisting a rubber band. Topoisomerase enzymes relieve this tension by creating a temporary break in the DNA strand, allowing the structure to relax and then resealing the break, all in a matter of seconds. Without topoisomerase, DNA replication would stall, making this enzyme essential for cell survival. Topoisomerase inhibitors work by interrupting the repair step of the DNA unwinding process. They trap the enzyme right after it has cut the DNA strand, preventing the break from being resealed. This leads to a buildup of DNA strand breaks. In rapidly dividing cancer cells, this damage overwhelms the cell's repair systems and triggers cell death. It's a clever strategy, using the cell's own essential machinery as a weapon against it, turning a vital process into a fatal flaw for cancer cells. There are two main types of topoisomerase inhibitors, classified by which enzyme they target. Topoisomerase I inhibitors such as Topotecan Irinotecan cause single-strand DNA breaks. Topoisomerase II inhibitors like Etoposide cause double-strand breaks. Both types are powerful anti-cancer agents, but they differ in their chemistry, clinical uses, and side effect profiles. Let's break down each group to see how they work and where they're used in cancer therapy. Topoisomerase I inhibitors are semisynthetic analogs of camptothecin, a compound first extracted from the bark of the Chinese tree Chemotherapy acuminata. These drugs act specifically during the S phase of the cell cycle, when DNA is actively replicating. By stabilizing the topoisomerase I DNA complex, they turn a normally reversible single-strand break into a permanent, lethal one when the replication machinery collides with it. This targeted action makes them effective tools in the fight against cancer. Topotecan is primarily used for ovarian cancer and small cell lung cancer, especially after initial chemotherapy has failed. It's also sometimes combined with cisplatin for treating cervical cancer. The most common side effects are gastrointestinal, including nausea, vomiting, abdominal pain, and loss of appetite. Bone marrow suppression is another key concern, so blood counts must be closely monitored during treatment. Understanding these side effects is crucial for safe and effective patient care. Irinotecan is unique because it's a prodrug, meaning it must be activated in the liver to become its more potent form, SN38. A clinical detail to remember: irinotecan can inhibit acetylcholinesterase, leading to an early cholinergic reaction with symptoms like flushing, cramping, and diarrhea soon after infusion. That's why patients often receive atropine beforehand. Irinotecan is a backbone drug in metastatic colorectal cancer, but its dose-limiting toxicity is severe, delayed diarrhea along with neutropenia. The other side, we have topoisomerase II inhibitors, with Etoposide as the main example. Etoposide is a semisynthetic derivative of podophyllitoxin, a plant-based compound. It stabilizes the DNA complex, causing double-strand breaks that the cell cannot repair in time. Etoposide is used in testicular cancer, small cell lung cancer, and both Hodgkin and non-Hodgkin lymphomas. Major side effects include leukopenia, gastrointestinal upset, and hair loss. Science of topoisomerase inhibitors has rapidly advanced. In recent years, topoisomerase I inhibitor payloads have become the engine behind a new generation of antibody-drug conjugates, or ADCs. Instead of giving chemotherapy alone, it's chemically linked to a monoclonal antibody that targets a specific tumor marker, delivering the drug directly into cancer cells. Trastuzumab deruxtecan, Enhertu, and sacituzumab govitecan Trodelvy are leading examples, reshaping treatment for HER2-positive and triple-negative breast cancers. This strategy is dramatically improving the precision and effectiveness of cancer therapy. Beyond ADCs, research is ongoing into novel non-camptothecin topoisomerase targeting molecules and combination strategies. Scientists are exploring ways to pair these agents with DNA damage response inhibitors to overcome resistance and improve outcomes. Even after decades of use, the topoisomerase mechanism continues to inspire new approaches in modern oncology, showing that classic drug targets can still lead to innovative therapy. Let's recap the essentials. Topoisomerase inhibitors trap the enzyme after it has cut DNA, preventing repair and leading to cancer cell death. Topo I inhibitors like Topotecan and Irinotecan cause single-strand breaks and act during the S phase. Topo II inhibitors such as Etoposide cause double-strand breaks. Today, these mechanisms are being delivered with pinpoint accuracy through antibody-drug conjugates like Enhertu and Trodelvy, proving that even classic chemotherapy targets can be reinvented for greater precision and impact. That's a wrap on topoisomerase inhibitors. If this episode helped clarify the topic, make sure to subscribe to Oncoverse and turn on notifications so you never miss an episode. In our next video, we'll continue exploring the world of anti-cancer therapies. Until then, keep learning, keep questioning, and we'll see you in the next episode of Oncoverse. Before we go deeper, let's quickly revisit the structure of DNA. DNA is a double helix made up of two strands twisted around each other. This structure is essential for storing genetic information and for the processes of replication and transcription. The coiling and uncoiling of DNA are tightly regulated, and any disruption can have major consequences for cell survival. That's why enzymes like topoisomerase are so critical. They help manage the physical stress on DNA during these vital processes. During DNA replication, the unwinding of the double helix creates supercoiling and tension ahead of the replication fork. If this tension isn't relieved, the replication machinery can stall or even break the DNA. Topoisomerase enzymes act as molecular scissors, making temporary cuts to relieve the stress and ensure smooth replication. This process is especially important in rapidly dividing cells, like cancer cells, which is why topoisomerase is such a valuable drug target. Let's break down how topoisomerase works. First, the enzyme binds to the DNA and introduces a temporary break, either in one strand Topo I or both strands Topo II. This break allows the DNA to unwind and relax. Once the tension is relieved, the enzyme reseals the break, restoring the DNA's integrity. This cycle happens rapidly and repeatedly, keeping the cell's genetic material stable and accessible for vital processes. Cancer cells are especially vulnerable to topoisomerase inhibitors because they divide rapidly and rely heavily on DNA replication. By blocking the repair of DNA breaks, these drugs create a crisis for cancer cells, overwhelming their ability to survive. Normal cells can also be affected, but cancer cells are hit hardest due to their high replication rate. This selective vulnerability is what makes topoisomerase inhibitors effective anti-cancer agents. It's important to distinguish between Topo I and Topo II inhibitors. Topo I inhibitors cause single-strand breaks, which are usually easier for cells to repair, but when combined with DNA replication, these breaks become lethal. Topo II inhibitors cause double-strand breaks, which are much more difficult for the cell to fix. Both types disrupt the cell cycle, but in slightly different ways, and each has unique clinical applications and side effect profile. Camptothecin, the parent compound for Topo I inhibitors, was originally isolated from the bark of the Camptotheca acuminata tree in China. This discovery was a breakthrough in cancer pharmacology, showing how natural products can inspire powerful new drugs. Today's Topo I inhibitors are semisynthetic analogs, designed to improve effectiveness and reduce toxicity compared to the original compound. Topo I inhibitors are unique because they act specifically during the S phase of the cell cycle, when DNA is being replicated. By stabilizing the DNA topoisomerase complex, they convert a reversible single-strand break into a permanent lethal lesion if the replication fork collides with it. This phase specificity helps target rapidly dividing cancer cells, making these drugs especially effective in tumors with high growth rates. Topotecan is a key Topo I inhibitor, mainly used for ovarian and small cell lung cancers, especially after other treatments have failed. It's also used with cisplatin for cervical cancer. Its side effects are mostly gastrointestinal, like nausea and vomiting, and it can cause bone marrow suppression, so regular blood tests are essential. Understanding these details helps ensure safe and effective use in clinical practice. Irinotecan stands out because it's a prodrug, meaning it needs to be converted in the liver to its active form, SN38. This active metabolite is much more potent than the parent drug. This activation step is crucial for its effectiveness, and any issues with liver function can impact how well the drug works. It's a reminder of how important pharmacology and patient monitoring are in cancer therapy. Unique aspect of irinotecan is its ability to inhibit acetylcholinesterase, leading to early cholinergic symptoms like flushing, cramping, and diarrhea shortly after infusion. To prevent these reactions, patients are often premedicated with atropine. This clinical detail is important for anyone administering or receiving irinotecan, as it helps manage side effects and improve patient comfort during treatment. One of the most challenging side effects of irinotecan is severe, delayed diarrhea, which can occur days after treatment. This side effect can be dose-limiting and requires careful management, including hydration and sometimes additional medications. Neutropenia or low white blood cell counts is another risk, so regular monitoring is essential. These details highlight the importance of supportive care in oncology. Etoposide, the main Topo II inhibitor, is derived from podophyllitoxin, a compound found in the roots and rhizomes of certain plants. This natural origin is another example of how plant-based compounds have inspired important cancer drugs. Etoposide's semisynthetic design improves its effectiveness and safety, making it a mainstay in several cancer treatment regimens. Etoposide works by stabilizing the DNA complex, causing double-strand breaks that the cell cannot repair in time. This leads to cell death, especially in rapidly dividing cancer cells. The double-strand break mechanism is more difficult for cells to overcome, making etoposide a powerful tool in the oncologist's arsenal. Etoposide is used in a variety of cancers, including testicular cancer, small cell lung cancer, and both Hodgkin and non-Hodgkin lymphomas. Its broad range of indications reflects its effectiveness in targeting rapidly dividing cells. However, its use requires careful monitoring for side effects, especially leukopenia and gastrointestinal upset. Main side effects of etoposide include leukopenia, which increases infection risk, gastrointestinal upset such as nausea and vomiting, and hair loss. These side effects are important to monitor, and supportive care measures can help manage them. Understanding the risk profile helps clinicians and patients prepare for and address these challenges during treatment. Antibody-drug conjugates, or ADCs, represent a major leap forward in cancer therapy. By linking a topoisomerase inhibitor to a monoclonal antibody, these drugs can deliver chemotherapy directly to cancer cells, sparing more normal tissue. This targeted approach increases effectiveness and reduces some side effects, marking a new era in precision oncology. Trastuzumab deruxtecan, marketed as Enhertu, is a leading ADC that links a topoisomerase I inhibitor payload to a HER2 targeting antibody. This combination has transformed treatment for HER2 positive and even HER2 low breast cancers, offering new hope for patients who previously had limited options. Enhertu's success highlights the power of combining targeted therapy with classic chemotherapy mechanisms. Sacituzumab govitecan, known as Trodelvy, is another ADC that pairs a topoisomerase I inhibitor payload with a Trop2 targeting antibody. In 2026, Trodelvy gained expanded approvals for earlier use in triple-negative breast cancer, including in combination with immunotherapy. This advancement is improving outcomes for patients with aggressive cancers and limited treatment options. Development of ADCs like Enhertu and Trodelvy is dramatically improving the precision of cancer therapy. By delivering topoisomerase inhibitors directly to cancer cells, these drugs minimize damage to healthy tissue and maximize their anti-cancer effect. This approach is setting new standards for how we think about and design cancer treatments. Research into topoisomerase inhibitors is far from over. Scientists are developing novel non-camptothecin molecules that target topoisomerase in new ways. Combination strategies such as pairing these drugs with DNA damage response inhibitors are also being explored to overcome resistance and improve patient outcomes. The field continues to evolve, offering hope for even more effective therapies. Combining topoisomerase inhibitors with other drugs, such as DNA damage response inhibitors, is a promising strategy to enhance effectiveness and overcome resistance. These combinations are being tested in clinical trials, and early results suggest they may offer new hope for patients whose cancers no longer respond to standard treatments. Journey of topoisomerase inhibitors from classic chemotherapy agents to modern, targeted therapies like ADCs shows how scientific innovation can reinvent even well-established drug classes. By building on decades of research, today's treatments are more precise, effective, and patient-friendly than ever before. Therapeutic precision is at the heart of modern oncology. By targeting drugs directly to cancer cells, we can increase effectiveness and reduce side effects. Topoisomerase inhibitors, especially in the form of ADCs, are leading the way in this new era of personalized cancer therapy. Monitoring patients closely during topoisomerase inhibitor therapy is essential. Regular blood tests, symptom tracking, and supportive care help manage side effects and ensure the best possible outcomes. Effective communication between patients and healthcare teams is key to safe and successful treatment. Managing side effects is a critical part of cancer therapy. For topoisomerase inhibitors, this includes addressing gastrointestinal symptoms, monitoring blood counts, and providing medications like atropine when needed. Proactive management helps patients stay on therapy and improves their quality of life during treatment. Future of topoisomerase inhibitor therapy is bright, with ongoing research into new molecules, delivery methods, and combination strategies. As our understanding of cancer biology grows, so does our ability to design smarter, more effective treatments. The story of topoisomerase inhibitors is far from over. Behind every cancer therapy are real patients and families. The advances in topoisomerase inhibitor therapy have brought new hope and better outcomes for many. Listening to patient stories reminds us why continued research and innovation matter so much in the fight against cancer. Effective cancer therapy relies on teamwork among doctors, nurses, pharmacists, and patients. Each member of the healthcare team plays a vital role in delivering safe, effective, and compassionate care. Collaboration ensures that patients receive the best possible outcomes from topoisomerase inhibitor therapy. Education is key for both healthcare professionals and patients. Understanding how topoisomerase inhibitors work, their side effects, and the latest advances helps everyone make informed decisions. Channels like Oncoverse aim to bridge the gap between complex science and practical knowledge. To sum up, topoisomerase inhibitors are a cornerstone of cancer therapy, with unique mechanisms, important clinical uses, and evolving roles in modern oncology. From classic drugs like Topotecan and Etoposide to cutting-edge ADCs, this drug class continues to shape the future of cancer treatment. As we look ahead, the field of oncology is filled with promise. New discoveries, better drugs, and more personalized approaches are on the horizon. Topoisomerase inhibitors will remain a key part of this journey, helping patients and clinicians tackle cancer with greater precision and hope. Thank you for joining us on this deep dive into topoisomerase inhibitors. Stay curious, keep learning, and remember that every advance in science brings us closer to better outcomes for patients everywhere. We look forward to seeing you in the next episode of Oncoverse, where we'll continue to explore the fascinating world of cancer therapy.